Hello, and thank you for attending the Workforce Flathead Opportunities Fair today. We are excited to be with Kalispell Regional Healthcare and glad to have you on this virtual platform with us. My name is Jody Smith, and I am the Workforce Training Director here in the Continuing Education Center at Flathead Valley Community College, and I get to be your moderator for today. Just a few housekeeping items real quick. All of the Opportunity Fair webinars this month are being recorded, and many of you have maybe heard this a time or two, but will be posted on both the workforceflathead.com website as well as Job Service Kalispell's YouTube channel. And so those should be very accessible to you to review or watch new ones that maybe you have missed. We will plan to save some time at the end of this webinar to answer any questions that you may have. So please do use the Q&A function that should be at the bottom of your screen to submit any questions you have, and we will review those when we get later in the webinar. And lastly, we will also plan to share contact information for Christy and Kalispell Regional Healthcare at the end of the webinar as well. So please be looking for that at that time. Today, we are thrilled to have Christy Van Slake here with us with Kalispell Regional Healthcare, and I will turn it over to you. And thank you for joining us today, Christy.
Thank you so much. We're really excited to share what we're doing currently. We are absolutely growing, and we would love to have you join our team in a medical career. So the presentation today, we're going to go over really how we're investing in our employees. And so we have a lot of entry-level positions, and then we grow our employees. So we have current employees who are in a director level nursing position who started off as a C.N.A. And so we want to talk more about what that healthcare career path can look like for you. So I'm going to go ahead and start sharing my presentation. If you can just give me a moment to load that here. And hopefully you can see that now. Yes?
Coming through great.
Very good. So again, we're wanting to talk about how you can explore your future, discover your passion. And of course, Kalispell Regional Healthcare does include the Kalispell Regional Medical Center here in Kalispell, North Valley Hospital in Whitefish. We also have a brand new addition to our team here, which is Marias Medical Center out in Shelby, Montana. And of course, all of the many, many clinics that you see here in the Flathead Valley. A lot of those clinics are part of our team as well. So many of our positions would either be located in a hospital setting or they could be located in one of our clinics. So let's talk a little bit more about what we have to offer. So again, we're wanting you to start your journey with us. We want to invest in you. And what that means for us is that we're dedicated to investing in our staff, committed to providing you with the tools that you need to care for our communities. And no matter where you're at in your career, we would love for you to find your place with Kalispell Regional Healthcare. Some of the entry-level positions that we have are in more of that office setting. So those positions are called medical front office associate. You're doing administrative support for a medical clinic. Those are going to be receptionist duties like answering the phones and taking messages, providing exceptional customer service. So many of our employees who go into this position have a lot of customer service experience, and maybe this is their first office job. So we're able to help train them into that. They're going to learn more about patient check-in and check-out, scheduling appointments, doing reminder calls, just again, that full front office support. So before we let this
my name's
start,
Caleb.
Sorry about that. It was on autoplay. Before we get started with this little brief video, I want you to understand that we do have opportunities to advance into more of a clinical setting. So maybe you're working in our housekeeping department or working in our nutrition services department and want to advance into a medical career. This is going to be your first step. And this video is going to share a little bit with you about how to train to become a C.N.A. So let's get this playing for you.
I'm studying in this class to be a C.N.A. is what I'm trying to do. My plan is to become a nurse, and the C.N.A. is just a step towards that. I just like helping people. I like the person-to-person aspect of healthcare, so that's really what has pushed me towards it. C.N.A.s are a part of person-to-person care, and like they're right in there with the patient. And I want to get that experience as I'm going to become a nurse. And specifically why I want to become a nurse is because I had people in my church who were mentors to me, and they were nurses, and just hearing their experiences about being right there and helping people in their times of need really compelled me to become a nurse also. It was really cool to actually get to be with people, because sometimes in the lab you just deal with mannequins, but when we got into the clinical, it was way more fun and interesting, and that was really cool. Favorite part for sure. For a C.N.A, I think it's worth it for sure. It's not that long a training, and it's a pretty good career, I would say. And then for nursing, I'd just say buckle down and get ready, because it's a lot more studying and stuff.
My name is Kayla Comerford, and I am a C.N.A here in Kalispell, Montana. I was a caregiver for about 10 years. My sister is disabled, and I was partially her caregiver for a long time. That's all I know how to do, is take care of people. I took care of my grandma. I took care of my father-in-law. I had taken a break from caregiving for a little bit, and I worked with my husband and went to FVCC for the C.N.A program and got my C.N.A license. And I got this opportunity to come be a C.N.A here at the hospital. I've been a C.N.A for a year and a half, and I do not regret a single thing of being a C.N.A. A normal day for me basically looks like I come in, I get a report from the oncoming shift, I immediately greet my patient, I get their vitals straight off, I introduce myself, make sure they know who I am, make sure that if they need anything. I usually have 8 patients a night, which is perfect amount for a C.N.A. If you love people, if you are good with people, if you just are good at caring, then being a C.N.A is a perfect job for you. If you feel like you want to do something and help your community somehow, and you don't know how, I think being a C.N.A is a really good place to start.
Okay, so going on into a little bit more about the C.N.A positions, we are currently hiring for experienced and new C.N.As. We do have a sign-on incentive of $1,000 currently as well. Some of the areas that we're hiring for specifically are Brendan House. Brendan House is our transitional care and long-term care unit. We have a 5-star rating for that facility that we're extremely proud of. And we also have extra pay and bonuses that are awarded to exemplary employees in that facility. We are also currently hiring for the medical center and our North Valley location, and that would be in either the medical and surgical floors, the float pool, hospice, home health, a lot of different options out there. And you can absolutely go to our website to see all the different departments and what shifts they're hiring for to apply for a C.N.A. I don't know why this is here. Let's get rid of that box. You're probably seeing that box as well. Advance your career. So we are, as we mentioned before, really motivated on advancing our employees' careers. So we have education assistance and tuition reimbursement. We have eligible employees after 12 months of employment are encouraged to use our education assistance to advance their career. Some of the approved courses, and this is just a very small sampling, would be nursing, pharmacy, radiology, coding, C.N.A, physical therapy, occupational therapy, speech therapy, respiratory therapy, the lab, surgical tech, radiation therapy, and more. So we have this available to our employees and absolutely encourage everyone to utilize it to advance their career. And a little bit more about an advance would be the certified medical assistant.
I like helping people in general. The more I can help people in my daily life and get a job doing it, the better I feel at the end of the day. My name is Kelly Weiss, and I'm here studying the Certified Medical Assistant program. It entails a lot of practical application of what you would do in an actual clinic or doctor's office, ambulatory care as opposed to bedside care that you see in nursing facilities. And I think it's a good stepping stone if you want to go on to be a physician assistant or even a RN or into the radiology, even, do phlebotomy. It's kind of wide open.
It's an amazing job. You get to do tons of things within an 8-hour period. I'm Charlene Hampton. I'm a medical assistant in Kalispell. As a medical assistant, every single day is something new. You learn new diagnoses, you learn new diseases. You get to really visualize a lot of like primary care or specialty clinics. So if you're into bones, you can be a medical assistant at an orthopedist, and you can be specifically in fractures. where you're casting them and you get to see the x-rays. Or I prefer primary care. That's where I work now. You're going to bring patients back. You're going to get their vitals. You're going to get the medications and allergies, make sure they're all correct in case there's going to be any kind of prescription changes. We, in the middle of rooming patients, we do, when patients do call in, and we are responding to those messages as quickly and promptly as possible. We also help each other out. I mean, because our schedules can get really busy. We have about 20-minute appointments, and that is a lot of patients in such a short time. We place referrals, we place orders, we pretty much assist in everything that the provider needs for that day. We chart prep each patient so we know what we're getting ourselves into before even going into the room. So I started the hospital when I was 18. I started in the kitchen, and then I have been able to work my way up to being a medical assistant, which I think is a wonderful career choice and a wonderful job. And all because of the hospitals providing me these little steps each way along the way of my little journey. And I do want to continue to be a medical assistant. This is something that I do want to do long term, and I really don't feel like I need anything else in my life because it's so satisfying. So Kalispell, you know, is wonderful. There's just so much to do every day that you can be here. In the winter, there's skiing. In the summer, fall, spring, there's hiking like Lone Pine, where we're at today. And this is literally my backyard. It's also called the Big Sky. So you have tons of things to be doing all the time with the wonderful views and wonderful people. If you want to be in the health field, I definitely encourage being a medical assistant, especially in this beautiful town called Kalispell, Montana.
So moving on to more exciting things as well, more apprenticeship programs. So right now we are currently working with FVC to create some new apprenticeship programs. Again, those are going to be coming soon where you have the opportunity to experience a new career. The areas of study and training that we're looking at would be the Certified Medical Assistant Program, Medical Front Office, Food Services, and more. So definitely stay tuned for more details on that. And just going into our benefits packages, this is really outlined pretty well here. So we do have some of the most competitive wages in the Valley. We do have a fantastic benefits package. We have options for medical, dental, and vision. Plan options are for full-time and part-time employees. We do have health savings accounts, flexible spending accounts, very affordable monthly premiums and yearly deductibles, and then elective dental and vision plans. We also have a retirement savings plan, a 401k, that does have immediate employer match and a supplemental match. We have amazing vacation, holiday, sick time, extended sick time, FMLA available, as well as an employee assistance program. The Summit Medical Fitness Center is a really fantastic facility where you can actually get your registration fee paid and discounted monthly membership fees there, with access to free and low cost wellness benefits programs, or just going and taking a swim or working out on a machine there. So a great facility there as well. And really, we keep talking about advancing your career. So if you love healthcare, then nursing could be the career for you. We would love for you to become part of Kalispell Regional's amazing nursing team. FVCC's nursing program can launch your career into nursing. So many of our employees start off with their C.N.A, that's Certified Nursing Assistant. If they already have their C.N.A or you already have your C.N.A or CMA, then we will help advance you. Maybe you want to become an LPN, a practical nurse, or a registered nurse, an RN. We have those opportunities to help advance you. Healthcare really is just helping people, which is, again, us wanting to help our employees as well. We have a new grad nurse residency program that offers great mentorships, hands-on training in a specific department. We have some of the departments that are working with babies, with pediatrics, and the surgery department. You can become a nurse and you can have a career where you can work anywhere. So of course we want you to stay with us, but just know that nurses are needed everywhere, and some people can train and go travel and come back. It's a great opportunity where you can have a career to go anywhere. And just a side note, a brand new nurse with a 2-year degree from FVCC is walking in the door of Kalispell Regional Medical Center making $26 an hour. So that's a pretty amazing jump for someone who is getting their foot right in the door, getting their education, and then starting that career. And again, just a little bit more about how to apply. You would go online to our website at krh.org/careers. That's one way to search for all of these positions and more. And we do also have specific recruiters here in our office. You could reach out to our nurse recruiter, Sunday. Her email is slighty@krmc.org. Barb Johnson in our office here does all of our medical office clinic recruiting, so all the CMA positions as well. And then in the hospital setting, I do the C.N.A. and the technicians recruiting here. And that is what we have to present today. So do we have any questions come up?
I was not seeing any posed yet, but here's your second chance. If any of you who are attending or do have something on your mind, please feel free to type it into the Q&A down at the bottom of your screen. Christy, I want to say I know FVCC is extremely grateful for the wonderful partnership that we have with Kalispell Regional. And so this is, I loved seeing the facilities there too. And thank you for the great partnership.
Yes, we're looking forward to more partnership. Absolutely.
Some people are sometimes wondering, are there opportunities for summer seasonal positions, or is that a little trickier?
It's a little trickier. However, it's something that we're looking into a lot more. So as we all know, relocating people to work here in the Flathead has become a little bit more difficult with housing. So some of the options we're looking into, as opposed to hiring a full-time barista or a full-time, you know, we're ultimately, we would love to have you full-time long-term, but we are absolutely looking into opportunities where we can provide some summer employment. The great part about that is that in most cases, it's also going to be at a premium pay. So it is going to be at a higher wage as well, but we are absolutely looking to add to our team and add that support and hopefully provide some great opportunities for those for the summertime. So yes, absolutely reach out to recruiting if that's something you're interested in, and we can take a look at the different positions that might be a good fit for you.
Thank you, I appreciate that. And just real quick, are there any particular characteristics or things that you look for in people that you're wanting to be part of the team there?
You know, really just helping people. I would say that those that are most successful here are ones who have that caring heart, that need and willingness of customer service, because even if you're, you know, working as a housekeeper or working as a C.N.A, you do have patient contact, and you do have that helping quality in every position here in the hospital. So definitely, I would say that's pretty much the number one. Everything else can pretty much be trained from there. So if you have a willingness to work and you have a heart for it, then we're here to train you and get you into those positions.
Wonderful. Thank you very much. All right. We didn't have any other posed questions, but really appreciate your time today. Thank you to those of you who attended as well, and hope you have a wonderful afternoon and take care. Thank you again.
Thank you, Jody.